and I have nothing of relevance to disclose. So by the end of this, we'll hopefully learn some strategies to start the conversation about weight management with the patient. This can actually be one of the hardest things to do because of some of the stigma associated with it. We'll learn to recognize some patient-centered barriers to seeking treatment for obesity and hopefully come up with some solutions. And then I think this next point is maybe the most critical, is how to guide weight loss expectations. Patients are often patients' expectations and our expectations are often different, and helping them come up with good expectations, realistic expectations that are still meaningful is important. And we'll use the data to guide us. The future is looking bleak if we continue with the current trends for obesity. This was published in, I think it was 2019. And by 2030, about 50% of adults in the US will have obesity by definition. The last point, I think, is also important just because of what we understand about health disparities. Severe obesity, and that's defined as a BMI of over 40 kilogram per meter square, will affect nearly 1 in 4 adults and become the most common BMI category among women, Black non-Hispanic adults, and low-income adults. So it's something that we really need to pay attention to and help our patients with. The first thing I think is important to do is just recognize that obesity is a disease. And that helps the patient and you think about it as a physiologic disturbance. And actually that makes the conversation go a little smoother. It's not just a disease, but it's a complex and chronic disease. And it's influenced by biology and non-biological conditions. So there are some things that are modifiable and there's some things that are less modifiable. Starting the conversation, I think Tara had talked about asking for permission to talk about weight management. And that's an important one to remember. Sometimes patients are relieved that somebody else has brought it up. It gives them, allows them to talk about it a little more. You are your patient's partner. And so again, it's not about the patient versus you, but you're working towards this common goal together. So how do you approach this? Well, I think, again, the first thing is ask permission to discuss weight management. And a simple way to do this might be, so you could be, for example, seeing a patient in your office and they have several weight-related comorbidities and they have an elevated BMI. And you might say something like, well, I noticed that your BMI is on the high side. Would it be okay if we took time to address this today? Or you could say your weight is on a higher side. Would it be okay to take time to address this today? And that allows them to say yes or no. And if they say yes, great. And if they say no, you say, well, maybe we'll talk about it some other time. But at least you've sort of planted that seed in the patient's mind that this is something that's important and important to discuss. I think it helps also that we approach it from a health-centric perspective versus a weight-centric perspective, meaning less emphasis on the numbers and more emphasis on outcomes. People first language is something that I think is also important. And so what this means is a patient has obesity. It's not an obese patient. It's not a diabetic patient. It's a patient with diabetes. And that really does help to, again, view this as a disease as opposed to a personality trait. And then recognize that weight bias and obesity stigma exists. So the data that's been published on this tells us that patients with obesity may experience poorer care or be reluctant to seek care due to perceived anti-fat bias among physicians and other professionals.